Hey guys, so I am here getting ready to go to the dentist and get a root canal and an extraction and then get set up for like a dental implant to be put in. The reason why I'm bringing this up is because I was given Valium as a pre-medication, and that is a benzodiazepine, and I'm also on methadone, and as you guys know, recovering from opiates. So that kind of sounds like contraindicated, benzodiazepines and opiates, right? So that's something that I think is really important, especially for those of you who are on methadone. Obviously, opiates and benzodiazepines do not mix. That's what has caused the highest death rate here in King County in Seattle. It's just stupid to do, which, you know. Anyway, but I did get prescribed it. Now it's Valium, and Valium is one of the longer to be metabolized benzodiazepines. It can stay up to 30 days in your system. So you could get a UA in 15 days and it's still there, unlike Klonopin or Xanax or something like that. But that doesn't mean that Xanax and Klonopin are any safer to take. Valium is actually the safer, or diazepam is actually the safer benzodiazepine to be prescribed if you are needing a pre-medication before dental work or anything like that. My point is, obviously, I'm not a doctor. You need to let your doctor or dentist decide what is right for you. But if you are on methadone or Suboxone maintenance, whether it's for pain or addiction, and you do need something like a pre-medication, it is really important that you let them know. If you do go to a clinic, get a letter from your counselor saying that this is a necessary thing. They can talk to your doctor about the dosage that's appropriate. Depending on what your milligram is on methadone, you may only need one pill or two, 5 milligrams, something like that. But I put this because you can't just ask for a pre-medication and expect to get it, because you do get looked at a little bit with a side eye when you are on methadone. Of course, the first thing they're going to think, are you drug seeking? Second thing they're going to think, well, she's on methadone, she shouldn't have this. That's not true, though. It's absolutely, again, depending on what your doctor and treatment center think, it can be perfectly fine. For me, 15 milligrams of diazepam with my 30 milligrams of methadone is okay. This isn't an everyday thing. This is because I'm getting a dental procedure done. So yeah, I just wanted to put that out there for those of you who are on methadone maintenance or Suboxone maintenance. Please don't let a doctor tell you that you can't or shouldn't have it. That's to be discussed with your methadone or Suboxone doctor. Let them make that decision and talk to your other provider. Also, when it comes to pain medication, of course, they're going to, be iffy about that as well. But they do need to understand, being on methadone, you will need a higher dose of pain medication. My clinic is great because they already have a letter ready to go for me to give to a doctor saying this client will need a little bit of a higher dosage. That doesn't mean let's get effed up on it. That just means methadone already gets in your system, fills up those opiate receptors. So a pain medication like a 5 milligram is not going to touch me, and therefore I'm still going to have pain. Again, this isn't to get high on, it's for pain medication. So talk to your clinic, talk to your provider, and just ask about maybe getting a letter if you are going to have a procedure done and will be needing pain medication, as to what the appropriate pain medication is for you. Be careful of things with acetaminophen in it, because that goes right to your liver, just like methadone, Suboxone. So there's all different precautions that you will have to take, but like I said, your clinic provider will be able to better educate you on that, and definitely they will educate your doctors. Doctors are still really behind in terms of methadone, but since it's such a big epidemic in the US, it's something that they need to get on board with. It's not okay to just deny a methadone patient pain medication or the correct dosage of pain medication because they're on methadone. Absolutely not. Methadone, we're not using it for pain, we're using it for our addiction maintenance. Totally separate things. So it's just important to make sure you discuss with your methadone provider. Make an appointment. I know it sucks to have to stay there longer than you need to, but make an appointment. Ask to get a letter, and just ask, hey, can you educate my general practitioner or my dentist on what is appropriate and what I am able to have depending on your dose. Like I said, some people are on like 100 milligrams of methadone and maybe it's not appropriate for them to have certain things. I am only speaking from my perspective. I'm on a low dose, so for me, my provider and my dentist thought that it was okay to have 15 milligrams of diazepam. One time. That's it. I didn't get a prescription for a week or a month. My clinic actually doesn't allow long-term prescriptions of that. So I just wanted to put that out there, a little bit of education. Just make sure that you are being your best advocate. Don't let a doctor or dentist make you feel that because you're on methadone, you don't have the right to the same type of aftercare as everybody else, because you absolutely do. But advocating for yourself as a drug addict may not always work. So that's why I say get your clinic provider on board, your counselor, everybody to advocate for you. That's what they're there for. It's your recovery, it's your sobriety. So please make sure that you're utilizing that. Okay, I'm about to go in. I have no lipstick on. I just took it off and I'm scared. Really scared. Fuck. And of course the Valium, because it is a lower dose, I'm relaxing now, but I guess, like, when you're used to, like, immediate feel better, having to wait for it to kick in is just a tad annoying. But that's real. That's real talk. That's still the addict in me. Like, it's not working fast enough. I want to be calm now. I have to wait, like everybody else. You gotta wait. Calm down. This is where having coping skills comes in. This is where being able to self-soothe comes in. And I just have to deal with it. And I will. Dental work isn't going to kill me. It's going to be fine. Have to learn the difference between pain and discomfort and managing those. So it's all just a learning process. Okay, thank you guys so much for watching. If you have any other questions about how to talk to your provider,